Great. So we're going to be talking today about safety and efficiency of synchronized RF and high-intensity facial muscle stimulation in patients injected with botulinum toxin. I just click here to make it go forward.
Yep, just click. It's got a little delay. Left.
There we go.
Yep.
These are Sunil's disclosures. I have not quite as many as him, but okay, good. So a little bit of background information. That slide passed, but I'll just mention it. Obviously, we're all comfortable with using botulinum toxin. We use it to selectively inhibit the movement of some of our facial muscles. And the objective and aim of this study was to understand what a novel technology that many of us are already aware of that's using high Fez, electrical muscle stimulation, combination with radio frequency, what effect it would have on the longevity and overall effect in facial appearance of the botulinum toxin. There we go. So specifically, the high Fez and synchronized RF are being used, at least in this study, there are more applications now, for the frontalis muscle, zygomaticus major and minor, and risorius muscle. And as we are all aware, aging affects skin, fat, and muscles and bones as we age. So the implications are meaningful. The methodology specifically was taking 12 patients, on average 60 years old, fits 1 through 4, injected with botulinum toxin in the past month, but no sooner than 1 week prior to the first treatment. There was a control group of 2, as well as the active group of 10, which consisted of 4 20-minute treatments. Follow-up was conducted at 1 month and 3 months. That consisted of digital photographs, as well as videos to best assess frown, smile, and the elevation of the brow. Evaluation was performed using the GACE and 3D analysis of all photos using quantificator system, as well as analyzing the digital photographs for wrinkles and facial volume improvement. Patients were asked for their comfort and satisfaction assessment with questionnaires. So some of the study outcomes, the digital photographs showed an improvement of 1.5, which stabilized at 1.3 at 3 months. And in videos, it was 1 month and 3 months, both was about 2.2. Facial expressions on the video showed visible muscle inhibition where the Botox was. That was unchanged even after 3 months. So the question of whether using muscle stimulation is going to make the Botox disappear faster were put to rest. There were no adverse effects observed. 90% of patients agreed that treatment was comfortable, and at 1 and 3 months, patients reported skin tightening and lifting effects and better definition of their facial contours. Patients agreed they felt and looked better after the treatments, and that was meaningful at 5.4. So here are some results that you can see. A 53-year-old woman at baseline and at 3 months after the M-face on the right. Visible improvement in the wrinkles if you look specifically around the corners of her mouth. And you can also see some elevation of her brow and the improvements one would expect with Botox injection of forehead, glabella, and crow's feet. 3D analysis revealed the most prominent improvement at 3 months, which showed a wrinkle reduction of 37% and an improvement of facial volume averaging about 1.5 syringes for each cheek. You can see these results here, and with the quantificator results on this 68-year-old gentleman with the Botox being done in his forehead, glabella, and crow's feet. And you can see in red is the improvement of the facial volume. No negative effects or adverse events. High satisfaction with treatment outcomes. The treatment is a combination of the monopolar RF and high Fez is safe and effective and is not going to substantially change the results from the botulinum toxin. Overall, the patients felt they had a positive effect on facial appearance persisting up to 3 months after the last treatment, and indeed this is enhancing the effect of the Botox. I wanted to show, I don't think it's coming through, but I had a video, but thank you for your attention.
Okay. Thanks, Sunil.